Hello, I'm Ed Conway. I cover economics and do lots of numbers and stuff for Sky News. And as you know, probably, I have done a lot of the data analysis when it comes to COVID-19. And so one of the things I've wanted to do was, having seen all of those charts, do you remember those charts we saw over the weekend from the Prime Minister, Chief Medical Officer, about COVID-19 and about the reasons for going into a second lockdown in England? I wanted to just try and go through that data and see if we can understand what it's actually saying, because it wasn't that clear to me. And in particular, there was one thing the Prime Minister said which leapt out, and you'll have heard it a bit elsewhere. If I zoom into this was the part of the statement that he produced afterwards. The virus is now spreading even faster than the reasonable worst case scenario. Now that is a big deal if it's doing worse than the worst case scenario. Except, here's the thing, I've been following this quite a lot. I don't really know what the reasonable worst case scenario is. And you might think, when you hear those words, worst case scenario, what might jump out into your mind is something like this. This was a chart that Sir Patrick Vallance produced in mid-September, suggesting what could happen to cases of COVID-19 in the UK if they were allowed to rise exponentially. And what he showed was it rising very sharply from around 3,000 new cases, this is daily reported cases, on the 15th of September, up to 49,000 by mid-October. Very high number, and it's worth asking the question, if that's the reasonable worst case scenario, are we indeed doing worse than that? Because that would be really, really terrifying. There is the doubling every 7 days line, and let's see what's actually happened. Have a look at this. Actually, reported cases, actual reported cases, and for that matter, I'll put on cases by specimen date, have risen far less quickly than that reasonable worst case scenario. Actually, they're up by about, if you kind of look at this, it's more or less doubling every 10 days, which is still not good, but it's nowhere near doubling every 7 days. There's a big difference, as you can probably see. And in fact, actually, reported cases, it's a bit worse than we're seeing in Spain and in France. I thought at the time maybe Spain and France is a clearer kind of path for where we might head. It's a bit less bad, it's a bit worse than that, but it's less bad than either doubling every 7 days or every 10 days. So, as I say, it's not good news, but it's certainly nowhere near that scenario if we're calling that a scenario. Now, hang on, you might well be saying, isn't the real point of this the fact that it's going up to 49,000? And probably you might have seen elsewhere figures showing that indeed cases have risen to, the daily rate of cases has risen above 49, 50,000. For instance, the ONS survey, so this is the definitive survey for how much COVID there is in the country, that shows cases at around 52,000 a day. Now, here's the thing though, that actually is apples and pears. That's a different measurement. What Sir Patrick was talking about was UK reported cases a day, and there's a reason it's worth just underlining the difference between the two things. Reported cases a day are only going to be the tip of the iceberg about how much COVID there is in the country. The ONS is trying to measure total how much there is, even amongst people who haven't been tested, whereas reported cases is purely the total number of people who get a positive test on a given day, or at least gets reported on that given day. There's a big difference, and let me just show you why it's important to distinguish here, and why you shouldn't really take seriously. If someone says, look, we're at 50,000, therefore Sir Patrick Vallance was right, that's not at all right. And here's why. So at the middle of September, the daily reported cases was around 3,000. That chart you just saw from Sir Patrick Vallance. ONS infections at that stage was around 7,000. And if you're going to do the same exercise, so doubling every 7 days for ONS cases, then look what happens. It goes up far more sharply, up to around 160,000 infections by the middle of October. And compare that with where we are in actual reality, and there is an enormous difference. So whatever measure you use, as long as you're consistent in comparing the right things, that projection that we heard about in September, we are nowhere near it. So that's something of a relief. But it doesn't clear up this issue as to whether that was indeed the worst case scenario. So for instance, Sir Jeremy Farrar, who is a member of SAGE, he said, and this is a tweet just a few days ago, on 21st of September, Sir Patrick Vallance, Chris Whitty, advised the UK could face 50,000 COVID cases by mid-October, 200 deaths, I should say, by mid-November. These based on SAGE reasonable worst case scenario. So he says that those lines you just saw were the worst case scenario, which is a little odd, isn't it? They were widely derided at the time, sorry, guilty. Both have proved underestimates of true infections and deaths. Well, on the death side, that's certainly true. Although there was a question mark at the time as to whether 200 deaths was actually slightly an undershoot. Because if you're talking about 50,000 cases, that would imply deaths of at least kind of 500-600 potentially, maybe getting up towards 1,000. Whereas this talks about 2,000. But at this point, both have proved underestimates of true infections and death. It's just plain wrong. The Sir Patrick Vallance 50,000 has not come to pass, nowhere near it. And this presentation from a member of SAGE I find slightly alarming because it's changing the goalposts after the fact. It's revisionist history. It's not the first time, actually. If you look at something else that Sir Jeremy Farrar said a few days later, we've surpassed the reasonable worst case scenarios that UK Science Chief, so that's Sir Patrick Vallance and Chris Whitty, CMO England and SAGE outlined in September. We won't see the sad consequences of level until the start of December. Now, again, this is revisionist history. If indeed that September illustration was the worst case scenario, no, we are nowhere near it. We're not in a good place, but we're nowhere near it. And I don't see how it encourages trust in our scientific community to change the goalpost, to, ex post decide that you were victorious. No, there was an illustration and it was unrealistic, and we have had an increase in cases that is not good, but it's been nowhere near that illustration. Anyway, it does raise another question as to whether there's a different worst case scenario going around here. So is there actually a worst case scenario against which the recent kind of increase in cases does look quite bad? And the answer is yes. So just the other day, The Spectator managed to get hold of a copy of a worst case scenario from July. And here's what it looked like. This shows the number of new infections per week under the reasonable worst case, that is the RWC, not Rugby World Cup, unfortunately, planning scenario. And certainly on this basis, on this worst case scenario, the UK is doing worse. What I've got is, I've just put that onto a chart so I can superimpose what's actually happened. And here's what's actually happened. Look, a very big increase in comparison with that July worst case scenario. That does not look good at all. And that, I presume, is what they're really talking about in Downing Street, because this obviously is worse. I don't think they're talking, it's 4 times worse actually. I don't think they're talking about that. That is the Patrick Vallance illustration, by the way. Almost vertical, doubling every 7 days. The reason it looks more sharp is because these are just weekly numbers. But that would be talking about 1 million weekly cases by late October, whereas we're nowhere near that, but we're not in a good place. And we are worse than this July worst case scenario. And I should say it wasn't just cases that the leaked documents talked about, they also talked about deaths as well. And when you look at deaths as well, you can see that right now, look at the black line, it's risen above where those deaths were expected to be on the basis of the worst case scenario. But you're probably wondering, there is another kind of thing that's a little fishy about this. Why was the worst case scenario, if indeed it was a genuine worst case scenario, talking about such a flat level of COVID throughout the autumn? Most of us know and realise that that's the period when you've got students going back to university, you've got kids going back to school. It is the kind of period, and it's the start of winter as well, it's the kind of period where you are more likely to see a tick up in the disease. And yet the worst case scenario didn't prefigure that at all. But what's interesting actually is if you take this worst case scenario for deaths and just imagine that they did get it right on the timing and they thought that the infections were going to rise in late September, October, as they have done. Let's just move that forward in time a bit and compare that with the line that we actually have. There you can see the black line is what actually happened in terms of deaths, and the white line is the worst case scenario. And on that basis, if this were just moved forward a bit, then perhaps we'd be more or less in line with it. I'm not saying that's a good thing, but the idea of us being way above the worst case scenario is slightly, it's a question of timing. Maybe it's just the timing was way out by a month and a half, and actually we're more or less in line with what was expected. I should say though, this dates from July, this original worst case scenario, and clearly, it hasn't been updated for a while, but it does seem as if in the meantime, the Prime Minister has got some other measures that he wanted to show us. And so when we got those charts over the weekend, they didn't include this, but they did include this very scary chart showing your potential death rate. So this is showing death rates from a number of different places. I'll show you which ones in a moment, and what could happen in the next few months. And all of them pretty much showing that the number of deaths would go above the peak in the first wave. And what they've actually done here, this is Sage putting together a number of different models from epidemic models from Public Health England and Cambridge, MRC Biostats, Imperial College there, London School of Hygiene and Tropical Medicine, and Warwick as well. The one that probably leaps out though is that one, the Cambridge one, which is talking about 4,000 daily deaths. And there was a headline actually after that press conference, look, we could be facing 4,000 daily deaths if we don't go into lockdown. And this is supposed to be part of the justification for lockdown. And it's an important thing. And it's good to some extent that we're now seeing this data. But here's the slightly odd thing. These lines actually are a bit old. They go back about a month or so. And so what we can do is to plot what's actually happened to deaths since those lines came along and work out whether it's in line with these terrifying lines. I don't know, we can't really call these worst case scenarios because they're alternative illustrations that they're feeding into Sage. But even so, we know they're feeding in. And we can work out whether we are in line with it. And what happens if we plot actual deaths? Well, have a look at this. Actually, it's difficult to see, so I'm going to zoom in so you can get a sense of where we are in relation to those lines. And you can perhaps see there that actual deaths, this black line, is below all of these plots, all of these models for what might happen to deaths. We're undershooting it already, and let's hope that remains the case, but that certainly wasn't something that came out of the Prime Minister's presentation. And actually, if you take specifically this blue scary line, the one that goes up to 4,000, now that's from this excellent team at Cambridge who are looking at what happens with this disease. And they, interestingly, are constantly updating their model. And the version that the government chose was one from, I think, the start of October the 12th. But since then, as you can see, things have changed. So they have changed their model, which is interesting, isn't it? So let me just kind of underline what we're talking about here. That's what's happened to actual deaths. So each day you can see each dot is a number of people who have died on each day. And that's the line that Cambridge provided to Sage, which they've put in that scary dossier over the weekend. But since then, a week later, they updated the line and it got a bit more shallow. A week after that, they updated the line again and it's even more shallow. And that's their up-to-date line. It's not the 4,000 deaths one. It's one that's more shallow. It might get up to 4,000 deaths. We don't, annoyingly, like so many pieces of these data, we don't get them released publicly. But for the time being, actually the outlook and the projection of where UK deaths are from COVID-19 is more benign than it was in those charts that we saw over the weekend. And that's just on the basis of data that's actually out since then. So things aren't quite as bad as that, but that's not to say they're good. But what is frustrating, and I've said it a few times and I'll probably say it again before the end, is the fact that it's not easy to get hold of these numbers. They're not being provided by the government as a matter of course. They're not telling us what their reasonable worst case scenario is. They don't tell us what the scenario is. They just say, oh, we've broken it. They need to provide us with what the actual scenario is. And happily now, I think for the first time, they provide us with a bit more data, or at least a few more charts. They haven't made it easy for us to get hold of them. I've had to trace some of these ones here. But for instance, over the weekend, what we got was a projection of what they expected to happen to deaths. So we'll keep an eye on that over the next few weeks and work out whether we are really in line with where they think we're heading. Of course, at some point, the lockdown measures will have an impact and will bear down on this growth potentially. But at least for the next 2 weeks or so, because it takes about 2 weeks for the measures to kind of be seen on infection rates, at least for the next 2 weeks, we'll get a sense of whether that's the right line or whether it's kind of overstating it. And the same again for hospitalizations. Actually, we've had hospitalization data in just the last day or two, which look a little bit better than expected. So again, might it be the case that this is an overstatement and that we're not necessarily going to hit that first wave peak? We will have to see. But as I say, it is disappointing, let's say, to put it lightly, at this stage in the pandemic, a pandemic that is all about data, that we're still having to extract this stuff out of the government and reverse engineer it and, guess basically, because a lot of what I've done has been guesswork, I should say, at what they are trying to model inside Downing Street. We need to know what the worst case scenario is so we know whether we're going to miss it or not. As it is, all we know is that they say that we've missed it and then we can't even work out, we're not even told what the actual worst case scenario is. For those of us who follow data, it's incredibly frustrating. But for everyone else, it's frustrating as well, because what matters with a pandemic is understanding what's happening with the spread. And there is a lot of data out there in the government's coffers which it's not releasing. And this is my final point, really. Last week, I don't know if you saw this, I had the story about how the number of care home cases in Leeds, and this is what the line here is, the number of care home cases in Leeds has shot up. And this basically shows you that's the spring, the rise in total COVID cases in care homes in Leeds, and it goes down, and then it shoots up very sharply in the last week and a half. And the frustrating thing is, this data exists for pretty much every area of England, and I presume it does for Scotland and Wales too, and Northern Ireland as well. But it's not publicly released. It's not publicly released. We wouldn't know about the fact that there's a sudden sharp uptick in care home cases, which is deeply concerning given that that was part of the problem that happened last time around. We wouldn't know about this had we at Sky News not managed to get hold of it. This stuff should be released as a matter of course. This is such an important point for the UK economy and for the UK, health system and for all of our well-being. And yet we're not being given the full information about the state of the disease. And it's unclear why not. In other countries around the world, many other countries, Belgium, Hong Kong, Taiwan, France as well, they produce much more data, much more transparently about what is happening with COVID-19. And the more data is produced, the better an idea we can have of what's happening with this disease. That matters enormously. And yet it's as if the government doesn't want to produce this stuff and the NHS doesn't want to produce this stuff publicly. And that's disappointing, because until it is clear what's happening with this disease, it's unlikely that people are actually going to have their faith in the government and faith in the NHS. And as a result, they may not necessarily be as likely to follow those lockdown rules. It's about generating trust in what you're doing as a government. And by not releasing this data and by coming up with spurious explanations about worst case scenarios that have been missed without actually telling us what the worst case scenario is, that doesn't really engender much trust.